Hi everybody, I'd like to welcome you to this webinar for World Suicide Prevention Day 2020. It's great of you to join us, and I'm really pleased to have with me here today Ivan Frkovic, the Queensland Mental Health Commissioner, and Jorgen Gullestrup, the CEO of Queensland Northern Territory Mates in Construction. My name's Bronwen Edwards, I'm the CEO of Roses in the Ocean. And look, collectively, we're just really here to have a bit of a chat, a casual conversation about how people are throughout Queensland working together to prevent suicide, which is, of course, is the theme of World Suicide Prevention Day this year. So firstly, Ivan, you know, there really is a big push towards bringing whole of government into suicide prevention. And I know you've been working incredibly hard in Queensland to make that a reality. What can you tell us about where things are at and how's it going?
Look, yeah, thank you very much. And it's great to be talking to actually both of you on this World Suicide Prevention Day. Look, the Queensland government has made a clear commitment publicly that their target is to reduce suicides by 50%, at least as a working target over the next nearly 10 years. And they really want to try and, you know, tackle this issue, which is clearly unacceptable as far as, you know, our community goes. Only last year, and again on World Suicide Prevention Day, if you recall, I wasn't here, but the Minister did launch Every Life, which was the Queensland Government Suicide Prevention Plan. And as a result of that, the plan actually builds on, you know, I think 3 or 4 really key things which we're all interested in, because I think based on the evidence, this is where we can make a difference. It really talks about how do we build resilience in our population, in our community, where people don't see suicide as an option. They've got a whole range of other tricks and skills and knowledge and things in their toolkit to be able to sort of deal with some of the life stressors and pressures that we experience. But also we want to try and focus on people that are at increased vulnerability. And we know that there are some groups in our community at increased vulnerability. We know that, for example, the data clearly says that, you know, men are at increased vulnerability for a whole range of reasons. And how do we focus on some of those groups to be able to impact? But then also people who have experienced a crisis. How do we make sure that we provide the right response at the right time to them, that people don't fall through the service gaps? And linked to the theme of World Suicide Prevention Day this year is about working together. And the plan talks about how do we bring the system, government, non-government, private systems together to actually achieve a change. And look, and you know, there is no rocket science in that, but I think there's a lot of work in all of those 4 key areas for us to achieve this. The government has not only sort of released a plan, because I have said sort of historically that, you know, having a policy without resources is philosophy, and we're not here to implement philosophy. The government then actually came forward and said we're investing directly $81 million in terms of particularly trying to address this issue. But also it wasn't just the 81, the government also sort of added more money into that through education, but also intervening early with the Right at Home program, the expansion in Qld, which takes the investment well over $100 million. I think that's a substantial both policy position, but also investment. And really, in brief, the plan really talks about that every touch point is an opportunity to intervene. We all have a responsibility. We all have a role to play, and we don't have to fear, if we're not a clinician, that we can't talk to people who might be experiencing a whole range of distressors. We also talk very clearly in that about both sort of areas that particularly you are working in, that you know, our workforce needs to be much broader than just around clinicians. We need people also with lived experience to be providing the level of support that people will also need and benefit from that intervention. But also particularly we need to target men, and particularly in the workplace, in industry, which I think Jorgen, yourself and your team do really well as well. So we've taken a whole of life, whole of population, whole of community approach. And look, and I am a little bit worried because I don't know what the impact of the COVID environment will be on the rates of suicide, both in Queensland and Australia. There has been some modelling come out of New South Wales, which is quite concerning, and I've seen some stuff from overseas. But look, I'm still hopeful that even though we haven't really had a chance to start to drive some of the implementation of this, because obviously COVID has become a major issue, the government has realised that even during the COVID environment, continuing to work on this is an important element in terms of also responding to COVID. So we've got a pretty clear plan, we've got a great level of buy-in, and we've got some resources to actually try and make a difference. So I'm hoping that collectively between all of us, we will start to see these rates going down over the next 2, 3, 4, 5 years.
Yeah, thanks, Ivan. It is really interesting, and I understand you're getting a lot of traction actually in bringing, individual government departments in and recognising that the Department of Transport and the Department of Education, all these different departments actually have a role to play as well.
Correct, and it's not just. I mean, I think, and I'll use this word more broadly. It's not the usual suspects that we should be just targeting. So usually we target. It's going to be that public mental health system, or EDs, or inpatient services, or even general practitioners. Now, yes, they're huge touch points, and we need to make a difference there. And I can talk to you about some of the work that's particularly happening at the Gold Coast in that HHS with the government, non-government, lived experience professionals, etc., which is actually showing some really great early signs in terms of reducing suicide. It's not just those players, though, that every touch point. So if a person's coming in distress to the Department of Housing, or they're in contact with the police, or they're in contact with child safety, we all need to be able to at least provide a level of response to be able to at least support that person, but also not just tell them to go and see the public mental health system, but provide that that warm referral, as I say, support people to access the services that they need. And again, they need the breadth of services, not just to see a clinician. They might benefit much better from seeing a paraprofessional or an allied health worker or a person with lived experience, or a combination of those, which I think is probably the best way to go.
Yeah. So, Jorgen.
Yeah.
Mates in Construction. I think you celebrated your 10th anniversary last year, didn't you?
I think 2 years ago. Time flies.
Love for you to talk to us about, the relationships and how Mates in Construction works together with government, with industry, with people with lived experience, with the corporate space as well.
I think in Bronwen, in some ways we were a little bit fortunate because of the way we came about. Because quite often when we are dealing with health issues, we're coming from a health perspective. We're coming from the health sector and coming with this sort of solution to the people who needs it. Whereas in terms of the background to Mates in Construction, there's much more a need that we actually found within the community, and say, what can we find to help us with that? It was just that we had experienced too much pain. We had seen too much pain, and we had to do something about it. And we had seen enough pain for us to reach across the aisle and starting to work together already by simply saying, between employers and unions, there has to be a unity ticket around this. And once we could create that, we could start unite people on a much broader front. So the whole background, so we were fortunate in terms of saying that actually the Mates in Construction model grew out of a deep pain and a need in our community that says we can't afford to continue going as we have been going up until now. Something has to change, something has to give. And then we could reach into the health system, and we could reach into the paraprofessionals, and we could reach into experts in the field and ask them to come and help us, but to do it in our terms. Mm. And therefore, this concept of working together to prevent suicide has been at the very core of what we did right back from 2008 and until today.
Mm.
What are the challenges of working together, Jorgen? What are the benefits that you see?
Well, I think we need to, when you work together, it's a process and movement, because of course, because we find a big problem, we start working together. All the conflicts we have, all the competing interests and all that doesn't go away. It just means that we have actually identified something that can unite us in some area. So I think the challenge for us particularly is to recognize that there is dispute and there is conflict and there is different interests within that community we have created, and we have to navigate that. We have to make sure that everybody is part of it in a way that is not to their detriment. But it's not going to go away. Like unions and employers still have conflicts. Workers still have issues where they don't feel they get well addressed, and employers still have issues where they feel that their workforce perhaps is not productive enough. And the doctors we are seeing have issues about saying, well, this is actually my turf you're coming into, and don't sort of start pushing me around. all those kind of things are there. We just have to learn to navigate them. You know, I think that what happened last year from when we got the suicide prevention plan in Queensland, where we actually for the first time, really, probably not for the first time, because we have had plans before that were sort of talking this language, but for the first time there was actually something really concrete behind it, saying that something has to change, and it was put together in a strategic way. I think that you know, it's commendable, and it's something we have taken and worked with, and we've then said, well, that idea, we can use that. We can actually use that concept when we go to government and say, we're doing this as an industry. Well, if you want to be all of government, you need to come on board. You need to come on board from a workplace health and safety perspective. You need to come on board from a government procurement perspective. You need to come on board from a health perspective. All those kind of different things, we can actually start pulling people together with those tools.
Look, and we were hoping that, you know, the policy context, just picking up Jorgen's point, is that, you know, the policy context provides the authorising environment. It provides the authorising environment based on the best evidence that we've got, and also, as I think has just been said, gives an opportunity for people like MATES and also Roses and others to progress their work within the context of where the evidence is suggesting, but also to be able to, again, to be able to compete for the resources that are there to progress the work that you're doing. I mean, I think in both of your situations, particularly what I like, you know, in the MATES, it's that peer-to-peer, but also, Bronwen, in your context, it's really the lived experience. How have you found the contribution of lived experience in the suicide prevention space? And how have you found working with government agencies, the non-government sector, but also the corporate sector in terms of the lived experience contribution? But then, Jorgen, also, I wouldn't mind hearing from you, how have you found the peer-to-peer work as well?
Yes. Yeah, it has been such an incredible shift. I think, you know, Roses in the Ocean started back in 2008. And I think, you know, Jorgen, to your point, when you're talking about how MATES came about because of the pain that was being experienced by your industry, it's the same with lived experience. So lived experience has, people with lived experience of suicide have always been trying to be heard, but it's, you know, it's now at a point where not only do people with lived experience have a voice, but they have a strong voice and they have a respected voice. And, you know, now we have a situation where government, other organisations, the corporate sector, research institutions, all of these different components of our community have really, they've come to a point where they really truly value the voice of lived experience. And are now inviting people in. And I think that is incredibly exciting, because there has needed to be a complete cultural shift, in my opinion, in terms of how suicide's even discussed, viewed, and how suicide prevention is actually delivered. And that cultural shift is happening. And I do believe that it's been the lived experience right across our country who have been driving that cultural change, because, you know, we're all human, and every traditional culture is built on story, and lived experience people bring the story, and they bring the numbers to life, and they remind people, why is this so important? So it's compared to even 4 or 5 years ago, the amount of opportunity that we have to work together now has exponentially grown. The ability to influence policy, the ability to influence the types of things that are funded. There's just an enormous sense of collaboration that I'm noticing, particularly in the last 12 months. I mean, since the whole of government has been really being pushed as a priority, there's a lot more appetite. And even the way that money is handed out now. You know, if you don't have lived experience involved in your tender proposal, or if you're not involving lived experience in your research project, you're not likely to get funded. And that's a huge shift. And it's very exciting where we now have a field where we have health professionals coming to the table with lived experience people, with hospital executives, to sit down and actually, for the first time, really look at what are the needs of the people we're actually here to serve, And how are we going to meet those needs? It's not about meeting the needs of the hospital or the needs of the clinicians. It's about meeting the needs of the people who they're trying to serve. And, you know, everyone gets up in the morning, I'm sure, and goes to work wanting to do the best they can to help another human being. But, you know, that system reform that we've so desperately needed, I believe is coming, and it's exciting. There's a long way to go, but there is a great appetite for people to be at the same table, and to acknowledge that that's hard. That's really hard. It's hard for everyone. There's pain involved in that from everyone's perspective, but that it has to be done. So, yeah, I'm seeing a lot more collaboration and working together, which is really promising.
Actually, if I can draw a bit of a parallel between what you said there in terms of some of the reforms we're talking about in the health system, to take into account lived experience, and some of the stuff we're doing in the workplace. I've sort of often said that if we had allowed the patients to design the health system, would it then look anything like what we have got? And my guess is it probably wouldn't. It would be very different. If I'm a patient, I still want excellent healthcare. I still want the best doctors. I still want the best processes. But my guess is I wouldn't come up with the same design and the same system and the same priorities as we perhaps have today. And that is not different to what mates in construction have done in some ways. Because when you think about a workplace often, the people who are experiencing the poor mental health and the suicidality are the workers on the ground. Often the most marginal workers will experience the most pressure. But to access those people or to provide them, we have to go through employment structures, and within those structures sits a number of traditions and an amount of history and an amount of vested interest. And all of those kind of things have designed the employment structures we currently have, which might or might not be the best employment structures when it comes to mental health and well-being. So actually, if we want to start informing them, we have to start listening to the unfiltered view of the people who are actually experiencing it and be prepared to listen to it. And therefore, often what happened, it's getting better now, but particularly when we were talking about mental health interventions for workplaces, they were almost always entirely been driven through the HR department and through the senior management. Get senior management buy-in first, and once you got senior management buy-in, it will flow down like a miracle cascade. And of course it might, but I also think that it's a little bit like it's not an invalid analogy to how we have looked at the health system over the years, about when we actually allow the people to stay in control, or we get the best health care because doctors know best. I think we have to be better at listening and actually bringing everybody into it when it talks to do suicide prevention together.
And in the current context, I mean, I think we're in an unprecedented environment at the moment, and obviously, things are changing rapidly, particularly as a result of COVID-19. We know that, as I said earlier, I think there has been all sorts of modelling done, and I think that there is a level of I suppose concern generally whether the suicide rates will in fact increase as a result of the experiences of COVID, and we know that. We're not sure about that. I mean, modelling is one thing, the reality could be something else, but clearly some of the risks, and I wanted to see, sort of at least hear what both your experiences are around, we know that some of the risks are around increased unemployment, for example, particularly for men, and we're seeing that in this environment. We're also seeing a whole range of issues around economic hardship, which we know is another risk factor, same as relationship problems, but also the social isolation, particularly amongst our older Australians. From your perspective, what are you seeing, particularly in this year of COVID, and, this year's World Suicide Prevention Day will be overlaid with that. Do we have some sense of the things that we're doing, are they working? And will we see, potentially, increased rates, or do we think the rates will stay the same, or will they actually decrease from where you're coming from, both lived experience, but also particularly in the sort of the construction industry?
Well, what we know is that in the period between March and July, we lost close to 8% of the jobs, 7.5% of the jobs in the Queensland construction industry. And we know that those jobs are not lost, are lost disproportionately high amongst the lower skilled workers. And we know from the global financial crisis and the work that was done by Elson Milner that highlighted how suicide rates increased quite dramatically between particularly laborers and operators within the industry when the crisis hit. So I think that we are in for a tough time when it comes to suicide prevention and mental health. We certainly observed a number of things, and this is again where when we start looking from the system rather than from the consumers. When COVID hit, what we found was everybody withdrew into their shell, and everybody isolated, and they did that for good reasons, because we didn't want this insidious virus to spread. Certain industries were essential industries, and construction was one of them. And what we found was construction workers going to work in the same sites, using the same lifts, having the same lunchrooms as before, when everybody else withdrew. And some of the services provided to the industry, such as for instance our employee assistance program, withdrew from interpersonal, from face-to-face delivery. Now, what that meant to us was that we had an increase in terms of case management, because our case management is delivered in a face-to-face manner, but we had a 30% reduction of people actually attending counselling. So at the same time where we actually had an increased demand for services, we had a decreased utilization of the services we had, because the services were not prepared to deliver, or not capable of delivering in the mode that was acceptable, culturally acceptable to the people we were dealing with. We just have to be better. We just have to be much better at actually listening to our end consumer.
Yes. And Bronwen, have you had any experiences during this period that you think give us some insight into how we're how we're tracking, or how we're going to track?
Yes, but they're mixed, Ivan. So particularly in the first part of the year when COVID first became reality in Australia, a couple of months down the track, we were having hearing murmurs and reports through from different pockets of lived experience people around the country, where there were less presentations, where people that were known to community for regularly being in suicidal crisis were actually not. People were saying to us, we actually feel better at the moment because everyone else is isolated. And now people understand what our life is like all the time. And telehealth, remarkably, telehealth is possible. People have been asking for telehealth for ages, and it came. And people were much more conscious about, I need to reach out to that friend because they're on their own. And so there was this connection. But we're not hearing that so much now. And when you look at the people down in Victoria who've gone into this second significant lockdown, that seems to be having some pretty significant impacts on people, a lot of anxiety, a lot of isolation, and feeling very alone again. I think I remember sort of thinking a couple of months ago, I was wondering whether COVID was going to have a big enough impact in the country to actually change behaviour long term, and would never ever wish Australia to go through COVID like other countries in the world have, never. But you would really hope that we could have that really human connection and that desire to reach out and be with people to stay. And I hope people don't go back to their normal ways in their own little bubbles. I really hope that doesn't happen, but that will, time will tell. But I think there's been positives and negatives. I think I am concerned, I think like everyone else in the sector, as to what happens further down the track. When JobKeeper does run out, when all a lot of people have been helped, not everyone, but a lot of people have been kept afloat. And when that lifebuoy isn't there anymore, that's when I'm concerned about all those underlying factors that we know can contribute to bringing someone to a point where they're really considering, suicide as an option. So yes, definitely concerned. I'm also encouraged by how much creativity and innovation has been born out of COVID. As our organisation, we're doing things that I would never, ever last year have said we'd do. You know, there are components of what we do that I'll say now we'll never do online because I don't think we should, but we are delivering some of our training online. We are co-designing safe spaces very, very capably online. And in fact, we've just filmed a whole group of people, lived experience and health professionals from a co-design process we recently finished in New South Wales, who have actually shared with us that they enjoyed the online process even more because they felt incredibly safe. You make sure that you go around your Brady Bunch in the Zoom to make sure everyone gets a say. And they were comfortable sitting in their homes contributing to a process when they were having to talk about really personal things. So, you know, I think we've got a lot to learn. I think there's some positive things to come out of the situation we've been thrown into. But I do think there's a lot of people out there that have found it incredibly challenging and will in the future. So we absolutely have to be thinking creatively about how we wrap around those people for a long time.
I also think we need to look at COVID in two stages. There's a health stage and there's the economic crisis stage. And I think often when we're hit by something external, whether that being a natural disaster or whether that being COVID or whether it's being war or whatever, people tend to look to each other for support and comfort and connection. But when we go into a financial crisis, we actually start competing with each other. And we start moving away from each other. So even though this was perhaps unusual in the way that actually part of the crisis was enforced isolation, we nevertheless were jointly isolating to fight the common enemy.
Yes.
Now, once this common enemy creates a crisis, it becomes a competition between us, and that is much more damaging.
And just to pick up both of your points, like we've seen, particularly around the mental health and suicide and drug and alcohol, you know, fairly comprehensive federal government responses in a whole range of fronts. From a Queensland, you know, sort of perspective, the Queensland government as well made an immediate response in terms of the nearly $30 million immediately, particularly to boost the community sector to support people because people were not coming to hospital anymore for a whole range of reasons, as we know. But they were able to quickly mobilise and fund non-government community mental health, drug and alcohol, Indigenous community control services, etc. But picking up your point, particularly Jorgen, around the economic stuff, only last week, the Premier announced an additional $46.5 million as part of Queensland's economic recovery, which I think is a phenomenal way for the Queensland government to see that you can't have economic recovery without human and social recovery in this country. And mental health, in the broad scheme of things, which includes suicide and drug and alcohol, a whole range of things, is an important component of that human and social recovery. So I was really quite, you know, sort of, I suppose, felt really positive about that response because it wasn't just a health response. This was an economic response, which recognises, and I think picking up your, Bronwen, point around that, you know, things like JobKeeper and JobSeeker are probably some of the best suicide prevention strategies we've got in terms of doing it, but then complemented with a whole range of things which the state government has done in terms of investing as part of its economic recovery plan into human and social services and mental health specifically, I think is really a phenomenal way to look at how we as a society have evolved and how governments have responded in terms of addressing mental health, suicide prevention and drug and alcohol in a pandemic. I just think that's been a major shift from at least where I sit.
Yeah, agreed. I'm wondering, because we're coming to the end, we've just got a few minutes left. I'm wondering if you have 1, 2, 3, you know, what would be your pick of what are the opportunities to be working together in the next 12 months? Jorgen, your perspective?
Oh, that's a good one. But I think we are already doing it to some extent because it comes natural. I think that we work together around problems, and if we take the right mindset to the problems we have, we would find who's actually useful in terms of supporting them. So we certainly have reached out to a lot of other organizations in terms of this to actually find, rather than us trying to have expertise in this area, we might dig into somebody else who actually knows about this rather than trying. On the negative thing, I think we've still got a way to go in terms of actually bringing the community sector and the public sector together. That's a work in progress that we need to do. And I also think we need to longer term have a look at, in terms of the funding models, whether it's the right funding models to get the outcomes we really want, which is collaboration and working together. But I think that my experience is something have changed over the last 12 or 18 months to actually becoming a more collaborative sector. Because if you would have asked me a year ago or 2 years ago about the suicide prevention sector, I would have said it's the most brutal sector I've ever worked in. I've been a union official for 13 years, and they're pussycats compared to how we are treating each other in this sector. But I actually think that things are getting better.
And Ivan, from your perspective?
Look, I think we've got, I think at both the federal and at the state level, we've got political commitment to actually work together. I think we've got some pretty well-developed, contemporary evidence-based policy sort of frameworks and authorising environments at the national and at the state level. I think where we've got to now take it is a bit more at the, a lot at the more place-based local level. What I would like to see over the next 12 months is much better governance, planning and co-commissioning between PHNs and HHSs at the local level. I'd like to see a lot more of that working together to reduce the silos across the service delivery system. And then I would also like to see much more integrated service responses, both in terms of, as I think Jorgen has said, across public, private and NGO, where people can get the right response at the right time, in situ, in community, before and early before they need to potentially come into inpatient care or ED. And I'd like to also see a workforce that clearly looks across all of the different elements, from the medical aspects to the nursing, allied health, paraprofessional, lived experience, as one workforce, and that we all have a contribution to make. And I think if we can get some of those concepts embedded down, I think, as picking up Jorgen's point, and I think yours too, Bronwen, that 18 months, 2 years ago, even 3 years ago, we were still very much in that fragmented, arguing with each other, competing for crumbs and small resources. I think we're in a much more mature space to work together and to achieve some of those things that I just spoke about over the next 12 months and 18 months and 2 years. And also in a difficult context, which is a context around we're still grappling with the COVID implications.
Yes, look, I absolutely agree. I really do. I believe that we have enormous opportunity open to us now. I think, it's like the table's been set and everyone is invited to the table. From a lived experience perspective, there is an army of people right across Queensland who have a lived experience, who want to do something to help. We have an army that we can harness to be part of this. And I think by bringing government and our NGOs, but also our corporate sector, our philanthropists and people with lived experience, I think we've got the opportunity to actually start getting incredibly creative and innovative. And as you say, bringing that suicide prevention right back into community where people really need it and want it to be delivered. And together, I think we can achieve it. So look, thank you both so very much for your time today. It's the International Association for Suicide Prevention set this theme of working together to prevent suicide, and they set it for 3 years. So we've had it 2018, 19, and now 2020. And when they did that in the beginning, I thought, oh, why would you do that 3 years in a row? But I think it's been a great idea because honestly, I agree with both of you. There's been a seismic shift in how people are working together. And whilst it's not perfect, I think we're well and truly on the way. So thank you both for your time today. And we, wish everybody well on this World Suicide Prevention Day. And thank you all for all the incredible work that each and every one of you are doing in your own little part of the community and in your roles. So take care.
Thank you. Thanks, Bronwen.
Thank you.